Your doctor told you that you have cervical radiculopathy, gave you a prescription for anti-inflammatories and sent you to physiotherapy. You looked up on the internet and found that this is caused by a pinched nerve in the neck, and now you worry that this may be a serious condition. Today I will explain what is going on with your neck. I'll talk about the symptoms, treatment, and things that you should avoid, exercise that you can do at home, and most importantly, how you can monitor your progression to know if you need surgery or not. So let's talk about cervical radiculopathy today. Let me explain what radiculopathy is. This is the cervical spine, and these are the nerve roots that exit from the spinal cord through these holes. We have 7 bones and 8 nerve roots in the cervical spine: C1, C2, C3, C4, C5, C6, C7, and C8. Between each vertebra there is a disc, like a cushion, and this is what a herniated disc looks like. Any of these nerve roots could be pinched, but the most common is C7, this one between the 6 and the 7 vertebra. When the nerve root is pinched, it doesn't hurt here in the neck, because the nerve root does not have pain receptors. The pain will be felt in all the areas innervated by that specific nerve root. The person may also be feeling tingling, pins and needles, numbness, and muscle weakness. So let's see some examples. The C5, 1, 2, 3, 4, 5, C5 nerve root is responsible for the sensation in the upper side of the arm. C5 is also responsible for the innervation of the deltoid muscle that raises the arm and the biceps that bends the elbow. So the person will feel weakness to do those movements. And there is also a deep tendon reflex that we can test. And this is here, the biceps tendon. When we compare the right and left side, we may notice that the reflex on the affected side is reduced or absent. The C6 is responsible for the sensations in the upper part of the forearm, the thumb, and the index finger. And the muscles that we test are the biceps that bend the elbow and the muscles that do extension of the wrist. And the reflex of C6 is the brachioradialis reflex. We have a tendon here. C7 is sensation mainly in the middle finger. And one of the muscles that is innervated is the triceps muscle. So the person will have difficulty to do push-ups or bench dips. C7 also innervate the muscles that do wrist flexion and finger strengthening. And there is a reflex specific for the C7, which is the triceps reflex. C8 is responsible for the sensation in the ring finger, pinky, and the lower side of the forearm. The weakness will be in the muscles that bend the fingers. T1 is the sensation in the lower side of the arm, and the weakness will be in the intrinsic muscles of the hand, which open and close our fingers. Radiculopathy means that there is an injury on the nerve root. So it will affect the sensations, the muscles, and the reflexes specific to that nerve root. The 2 most common causes of radiculopathy in the neck are disc herniation and bone spurs caused by osteoarthritis. Disc herniation is more common in younger people, and osteoarthritis is more common in older adults. As I mentioned before, the main symptoms of radiculopathy will be away from the neck, mainly in the shoulder, arm, forearm, and hand, and one side usually. There might be a bit of discomfort in the neck and upper back area, and this could be due to the muscles that will become tense to hold the neck until the disc herniation is healed. Disc herniations will take approximately 90 days to be reabsorbed. They do heal. So 90% of people will not have any symptoms by 90 days from the start of the symptoms of cervical radiculopathy. When the radiculopathy is caused by other conditions like bone spurs, this 90 days rule does not apply. Before I show the exercises for cervical radiculopathy, I think it is important to explain the positions that aggravate the symptoms, and this should be avoided in the early phases of the disease. So it is common to see patients holding this position, or they come like this. This is what we call the shoulder abduction sign. The patients say that this position relieves their pain in the arm, kind of centralizing the pain or bringing the pain closer to the neck. Anything that causes more pain away from the neck is bad, and we call this peripheralization of the pain. In this position, the nerve root is not stretched, but if you keep the arm hanging like this on your side, you are pulling the nerve root down, causing more irritation. This test is useful for us to differentiate if the problem is coming from the nerve root or the shoulder, because when there is a shoulder disease like impingement, the pain will be worse if the person raises the shoulder, and so in this position. So if the pain is better in this position, it indicates that the source of pain is probably the cervical nerve root. So we ask the patient if there are positions of comfort, that they don't feel any symptoms in the arm. Then it is okay to stay in that position. Of course, it's hard to walk around the whole day with the arm like this. But when the person is sitting, the person may use a pillow under the elbow to support the arm. If the person uses the computer the whole day, it is important to get a chair with an armrest. And if the person works with a machine or repetitive hand movements, they need to take breaks to reduce the tension in the nerve root. We recommend the patient to maintain the positions that centralize the pain or reduce the peripheralization of the pain. NSAIDs are non-steroidal anti-inflammatory drugs, and they are used to reduce the inflammation caused by the disc herniation. Check my other video that I talk about the doses, contraindications, and precautions with the most common NSAIDs like Aspirin, naproxen, ibuprofen, diclofenac, and celecoxib. I will put a link to this video in the description below. In some cases, when the symptoms are very severe, we may need to use steroidal anti-inflammatories like prednisone, oral tablets, or steroid injections. NSAIDs are usually enough to control the pain, and the exercise that I will show you later in this video will be useful to control the pain and to maintain the cervical spine in a good posture to allow the body to heal. When the pain is very, very debilitating, the patient cannot sleep, or the pain is interfering with work or school, then we may need to prescribe a short course of tricyclic antidepressants or gabapentin to allow the person to return to activities safely. We usually don't recommend opioids, as there is some evidence that giving opioids to cervical radiculopathy delays the return to normal activities compared to people that did not receive opioids in the acute phases. I don't recommend a neck collar either. Initially, when the person uses a neck collar, they like it because the neck doesn't move, and that seems like a good solution. But the problem is that the muscles get weaker, and then the person, when the person tries to move the neck, they have more pain. So then they put the collar back again, and then they end up wearing the collar many hours during the day. So if the person doesn't move the joints of the neck because they're wearing the collar, there will also be reduced synovial fluid production, and the neck gets stiff. The muscles get shortened and weaker, and in the long term, it's just much harder to do rehabilitation and return to a normal life. I also don't recommend traction or inversion tables. There is no good scientific evidence to show that these are effective in reducing the symptoms or healing the disc. the disc herniation faster than not using traction. The natural course over the next 90 days is to get better and better. However, in less than 10% of all cases, there will be some worsening of the sensation loss and muscle weakness, and in these cases, the patient needs to ask their doctor. The doctor will probably order an imaging test of the neck, like MRI, and maybe doing an electromyography study. I have another video that I explain what an EMG or electromyography test is. Depending on the results of the imaging and EMG, your doctor may ask you to see a surgeon for an opinion about surgical decompression. Another condition that may require an urgent surgical consult is when there are signs of spinal cord compression. This is called cervical myelopathy. The main signs are poor finger coordination, gait and balance issues, and urinary urgency. So now, I'll talk about the positions and exercises that I recommend to my patients with cervical radiculopathy. Check with your physicians first if these exercises are okay for you. And also, before I continue, let me remind you that this video is not intended to replace medical advice. It is only for educational purposes. And if you need medical advice, contact your doctor, and in case of emergencies, go to the nearest emergency department or call 911. Before we start with the exercises, check how your neck range of motion is. So during the next 90 days, take notes of your progress, and you can download this worksheet in the description of the video below. So here you can take note of how much your pain is today, what was the lowest and what was the highest. 0 is no pain and 10 is the worst pain that you can imagine. Then take note of the range of motion. This is neck flexion, and this is extension, this is bending to the right side, this is for bending to the left side, and this is rotation to the right side, and this is for rotation to the left side. Now you're going to mark an X, 2 X's or 3 X's for the movements that you have most pain. So if this movement bending to the right side hurts a lot and you can barely move, then put 3 X's. You may complete one of this twice a week, let's say every Tuesday and Saturday. Then you will be able to see the progression of your pain, the range of motion, and how many repetitions of exercises you can tolerate. So now I'll start showing you the exercises that you can do at home for cervical radiculopathy. You don't need a lot of equipment. You need a towel, a mat, a long foam roller. This is 3 feet, 36 inches long, and a sturdy chair because we need to do some exercises on the chair. The main exercises for cervical radiculopathy are about posture of the head, the neck, and the shoulder. And I have another video that I did specifically for posture. So you may watch that video. I'll put a link of that video in the description below for you to check. But here I will show you 5 additional exercises that are really important if you have cervical radiculopathy. So let's get started. So the first exercise is in a chair. You can put a pillow here just to rest your elbow because, again, people who have cervical radiculopathy, it usually affects one side, and if they hang the arms like this, it's stretching the nerve root and it causes more pain. So every time that you do the exercises, do in a chair because then you can put a pillow here and rest your elbow so it's not stretching the nerve root. And the first exercise is the chin tuck, which is correcting the posture of the neck. And this is a very simple exercise you can do many times during the day. And I like that you do sitting here. You can rest on the back here, or you can just stay like this, whatever is more comfortable for you. So what you're going to do is bring your chin inside. That's basically it. So relax your shoulders. So usually we have a posture like this, right? So you're going to straight, and you can use your hand So bring your chin, looking ahead. The key here is that your nose is pointing forward. You're looking ahead, you're not looking down, you're not looking up. Your mouth is closed. And you're going to bring your chin inside. So stay in this position for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds, try to relax. And then do it again. So posture here, shoulders backward. And do this about 8 times. So then, and each time you hold for 10 seconds, okay? So chin tucked in. Don't forget to breathe. And count 10 seconds in your head. You can breathe deep. 9, 10. Okay, so do this 8 times. And you can do this like almost every hour, many times during the day. And then you're going to measure your progression if you can increase the amount of times that you can repeat this. Maybe you can repeat 12 times and 20 times, but each time you just hold for 10 seconds, but try to repeat more times. This is really good to bring all the muscles in the back aligned and open those foraminers that are squishing and pinching the nerve root. So the second exercise is the wall angel. I love this exercise for a lot of things, for shoulder impingement, for frozen shoulder, and now for cervical radiculopathy. So how we do wall angel, you stand a little bit, maybe 1 foot away from the wall, and now you're going to touch the wall with your pelvis, your back, the shoulder blades, and the back of your head. So you do this, try to relax here, and now, and why do you do this? Because you're aligning your cervical spine. All of those bones will be aligned, and you're going to start moving your shoulder, which is bringing the nerve root between those bones in the cervical spine close to each other and shortening the nerve roots. And also it's good because we need to maintain the range of motion of our shoulders while our body is healing the cervical radiculopathy that happened there, right? So then we start to touch the wall here with your elbow and hinge. And all you're going to do is raise slowly. If it causes pain, don't do it, but usually does not cause pain. So you're going to bring up, all the way up. And when you are here, remember to breathe, relax, and breathe, and go slowly down. Okay, and do this 8 repetitions. And as you progress, this becomes easier. Remember to tuck your tummy in. This becomes easier. And then the pain, you're going to notice that the pain is less and less. So repeat 8 times. And you can increase the number of repetitions. You can start doing 12 times and 20. And you can do again many times during the day. You don't need to do only once a day. You can find a wall that doesn't have any pictures hanging, doesn't have any door or window, and just find a bare wall and do your wall angels. So the next exercise is the neck extension. And I recommend you to get a sturdy chair, not one of those chairs that bend backwards, too much relaxed. So here I recommend you to lean your back on the back of your chair here. And then what you're going to do is relax your shoulders and you're going to start looking up. This is extension. We're going to try to do maximum extension that we can. Remember, you may have this limited in the beginning when the cervical radiculopathy started, but that's okay. Do within your limits. But you will notice that as the days and the weeks progress, this will become easier, less painful, until one day that this doesn't hurt anymore. So the important is that you maintain this range of motion and do this exercise to help in for the healing to happen. So look ahead and then start going up and go backwards. That's why it's important that you have a sturdy chair here, because then you're not going to lean backwards with your chest here, with your back. So go all the way up. So sometimes it's hard because when you come back, if your neck muscles are weak, this may hurt, and especially these muscles here in the front, the sternocleidomastoid, you need them to come back. So there is another way of doing this, which is with a towel. I'm going to demonstrate now with a towel. So here we're going to do the same exercise, the extension of your neck, but with a towel. Get a long towel here. Nothing special about this. You're going to put here behind your neck, and you're going to put this supporting on the lower part of your neck, and try to hold with both of your hands. But sometimes if you have radiculopathy going down to this arm, it might be hard for you and you might be weak on this hand here. So if this is not possible because one of your hands is hurting or you have weakness, you can just use the other one, the stronger head. But if you can, using both, this is what you should do. So when you go looking, doing the extension, and then the towel will be supporting your neck. And now when you come back, the towel helps you to come back. And it's much more comfortable doing with the towel than without the towel. So again, supporting, the towel will support on the lower part of your neck. And what you do is just hold here. When you go backwards, just let the towel support your neck, and it's comfortable, and relax when you get here, and then come back. The towel helps you to come back. So if you're liking this video so far, don't forget to like it, and don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos here. So let's talk about the next exercise. Is isometric exercises to strengthen the muscles of the neck, because when we are not using those muscles, they tend to become weaker and weaker, and we cannot allow this to happen because we need those muscles strong. But we need to do exercises that don't move too much our neck, right? Because it hurts. So isometric means you're going to strengthen the muscle, but without moving the muscle. How do you do that? Putting resistance. So we are going to do this for a lot of sides of our muscles. We have muscles that do flexion and extension and rotation and bending. So we are going to strengthen all of those muscles. So first, start putting some pressure and resistance on the front of your head here, above your eyes. And just, okay, relax here in your back. And now you're going to press your head against your hand. So here, I'm pressing my head against my hand, putting pressure, putting resistance. So I'm strengthening all of these muscles here without moving my head, without moving my neck. And you can do this for 10 seconds and relax. You can do this too. If both hands are hurting you, if one side is hurting, you can put a pillow here and support if this is the painful side. And then you can just put the other one here in the front and press against your hand. Okay? So that's resistance isometric exercise for flexion of your neck. Now we do the same thing for the lateral bending. You put pressure here. So you see I'm putting pressure against my hand, against my head, and I'm pressuring. So without moving my neck, I am strengthening these muscles here on the side for 10 seconds. And now for the other side. So then you count to 10 on your head. Don't forget to breathe. It's important that you breathe because we need oxygen. Okay, that's good. And now we need to do this for rotation here. So put your hand here on the top of your eye and try to rotate your head here. And your hand, you see my hand is putting pressure here, not allowing my head to rotate. And here. And now on the other side. And again, count to 10. Don't forget to breathe. And you can do 8 repetitions. So don't forget 1. Oh, we forgot the extension. So you put here and 2, and then 3, and then 4, the 5th, and the 6th. So for all 6 movements of your neck, you should be doing isometric strengthening exercises. Okay, for this exercise, we need our 3-feet foam roller. And this is an excellent exercise to relax the muscles, but also to open the foramina. If you can get one of these, this is amazing. You can put this on a mat, but you can also put this on a carpet or on your floor. Just make sure that you don't sleep and hurt yourself. What you're going to do is you're going to sit here and go back and put this in the middle of your spine. So your neck should be supported here. Okay. And here you can do your chin tuck. So here you can do, lower your chin here. And the most important thing now is you're going to relax your shoulders. You see how my shoulders now are behind my body. And this is the most important thing, that you stay in this position, allowing your neck to relax. So feel all of your bones here on your pelvis, the thoracic spine, and the back of your head touching the roll, and relax your shoulder. So let it open, stretching the pectoralis muscles here, and stay in this position. Maybe you can stay in this position 1 minute, 2 or 5 minutes. And this is amazing because this will relax and open the foramina and will allow your body to heal the cervical radiculopathy without putting too much tension in the nerve root. So these 5 exercises should be part of your routine for the next 90 days. But talk to your doctor if you're having worsening of your symptoms, or if there are new symptoms suggesting progressive weakness or myelopathy. Monitor your progression with the worksheet that I prepared, and after 90 days, the disc herniation should be healed. And if there is any residual pain, it's most likely a myofascial pain syndrome. The muscles were tense during the healing process, and sometimes they need more time to return to their baseline. For example, this muscle, the scalenes on the side of the neck, when they have these trigger points, the patient will feel pain going down the shoulder, the arm, and the hands. It does look like a C6 radiculopathy, but it's not. The pattern is different. The C6 brachioradialis reflex is intact, and there is no weakness of the muscles innervated by C6 nerve root when there is only myofascial trigger points. So then we apply pressure on the scaling muscles and the pain is reproduced. So this is typical of myofascial pain syndrome. So I suggest you to watch my other video of myofascial pain of the neck, where I show the SSAR routine for myofascial pain. Thank you for watching today. Goodbye.